Good afternoon. First, I would like to thank the organizing committee for inviting me, and sorry, I'm not able to join in person because I have a meeting conference actually in my country, which is already booked. My talk today about overcoming the learning curve in endoscopic spine surgery. I know that this is one of the interesting topic, especially for the people who want to join and learn the endoscopic spine surgery. Uh, these these are my disclosure, which is I don't think that's related to the talk. And let's start. That's how can we get our training? Let's say in my country, we get it through the clinical attachment, or we go abroad to get training, or through the training through the Ministry of Health, which is part of the subspecialty training program, or could be through the online course, which is I think that's we are living in the era of the resources that's available, or could be a face-to-face training and fellowships. But from my perspective, I think that's the mentorship is the most critical and most beneficial for anyone who want to join and learn a new technique. When I started to do this talk, I just dig deep in some books that's talking about the learning, and I will review it, uh, small notes on it. One of them is which is outlier, which is called 10,000 hour rules, which is I don't think that it's applicable in our specialty because this is me when I want to start the endoscopic spine surgery, and this is me after 10,000 hours, which is I don't think that's it's work. Second is skip the line, which is which is I like it because it's decrease the number of the hour that's required, and the third, which is the peak performance, through the mental presentation that's concentrated on the deliberate practice, and the third one is the 20-hour to learn anything, which is skip it. 10,000 to master the technique, while here it's 10 hour just to know the situation. And the very important books that think fast and slow, which is I think that's if I'm doing open discectomy in 20 minutes and why I want to start and struggling with a new technique, our brain keep us on motivate automation, so it's not uneasy to learn a new techniques, but we have to finding your why, which is I think that this is a cornerstone. We have to have a purpose to learn a new technique, which is I think that's in the endoscopic spine surgery it's already present. If we define the learning curve, it's this is from the Wikipedia, which is a graphical representation of the relationship between the proficiency and the experience, which is in the endoscopic spine surgery. Till now, I don't know what does it mean. Does it mean less complication, less time to do the surgery, automation, efficiency, or what? I don't know. But I think that's the factor that determined that the learning curve in the endoscopic spine surgery is the surgeon experience, orthopedic or neuro, when we are talking about the UBE, and the training center, how many cases per week that the center do, and the backup surgeon, or the pathology that you want to tackle, whether disc stenosis or number of level. So I published a chapter on this in this book, and I put the 12 steps. How can you start to learn and upgrade your level in the endoscopic spine surgery? First of all, you have to have your why, as I mentioned before. I think that's when we go to the literature, we show that's the number of the publication in the endoscopic spine surgery, and in some situation like this MRI, when we have foraminal stenosis, I don't think that's the open surgery will solve this problem, and the transforaminal will be ideal to solve this problem without jeopardizing the soft tissue and the facet. And the most important point that's this is a paper was published in Global Spine. They shift toward that the endoscopic spine surgery will become a gold standard. And another paper talking about the efficiency and efficacy of the endoscopic spine surgery, which is, I think that's all of them, they are tackling in the same way. So these are the advantage, and I don't know. I know that most of you you know it, so I will skip it. Second point, you have to have a smart, let's say, setting a goal, which is according to the SMART, and the most important point, don't depend on only on the extrinsic motivation. You have to have a discipline to get your goal, and the self-discipline is what separate the good from the truly great. This is the David Goggins mentions in one of his talk. Third point, the reference, and I think that we have lots of reference right now, videos, books, courses that's available, and the event. One of them is to get the information and the reference. Third is the mentoring, which is, I think that's from my perspective, the most important and the most practical steps to learn new technique. And it's better than any other form of learning. Overcoming the struggles, when I started, there was no any distributor of endoscopic spine surgery in my country. So I bought the sets from my pockets, and I started, and right now we have. So I don't think that's creating the, let's say, the struggling or waiting till everything will be good to start. It's a practical point. In my journey, I started with endoscopic spine surgery. It was in South Korea, 2018 actually, and I started with the easy cases for interlaminar 5S1. This is one of the initial cases that I started. And for for transforaminal 3-4, I think it's, let's say, posterolateral disc is also good option because of the large, big foramen compared with the 4-5 and 5S1. And after that, you can go to choose more complicated cases from disc to stenosis, and then to fusion and any other cases. And this is the ladder of competency progression according to the Kim in 2021. And backup surgeon in my initial cases, I invited one of the, let's say, master of endoscopic spine surgery, Anand Kavi. He's from India. He joined me in my initial cases, and I think that it was a great experience for me. And the plan B is very important. Let's say in my initial cases, I started to do, let's say, I discuss with the patient about the tubular microdiscectomy, and I went there to do endoscopic spine surgery. My 3-4 cases initially failed, so I already discussed with the patient about the tubular, so it was no problems. Feedback loop, every surgery I finish, I start to analyze and let's say and to see what was wrong, what was good, and how can I improve it, and also checking the patient outcome and so on. Asking the expert, and I have a very good social connection with many of the experts. This is Professor Lim. He supports me in my initial journey, and also this is Viali, who when I asked him about how can we correct the deformity in TLIF, I was using the cages at that time 8, 9. He told me that to use 12 at let's say at least, and nowadays I'm using 12, and this was in 2016. And also it's important to measure your progression, measure the surgical time, patient outcome, intraoperative struggling, level of the cases, complication rate, and the level that you reach let's say the automation. And I started to do disc prolapse, stenosis, synovial cyst, recurrent disc, ASD, discitis, and end up with the endofusion. And mastering your level by doing more complicated case, start to teach the others publishing the result, and also measure your learning curve. And this is my one of by mastering by expanding the indication, showing your work by participating in international conferences, and also be trainer for the others and mentoring. This is my team when they started to do the surgery. So this is my take-home message, which is, I think that it will help, and I would like to thank you. And if you have any question, I'm ready to answer. Thank you.